Hi, my name's Chloe and my pathology is achondroplasia. And achondroplasia is a genetic disorder that affects bone growth, which then leads to short stature and characteristic physical features. So I just had an order come through for an individual with achondroplasia, and they are here to get an x-ray of their tib-fib. So typically with achondroplasia, a lot of doctors will order x-rays of their long bones, so tib-fib, forearm, humerus, femur, and that is typically just to assess their bone development, because with achondroplasia, their long bones are significantly shorter than the average person. So before I go and grab my patient, I will get the room all set up and ready to go for them. Hi, are you Alexis?
Yes, I am.
My name's Chloe. I'm the x-ray tech that's going to be taking your images today. I have an order for a left tib fib. Is that correct?
Yes.
Okay, you can go ahead and follow me right around the corner here.
Okay.
Okay, can I get your last name and date of birth?
Weimer, 62804.
Okay, is there any chance of pregnancy today?
No.
Alright, so why are we doing this exam on your tib fib?
My doctor wanted to know my bone development.
Okay, just some updated images.
Yep.
Are you having any complaints?
Just some chronic pain.
Okay, sounds great. Before I went and grabbed my patient, I ensured that there was a sheet on our table here. And since the body part we are imaging is less than 10 centimeters, we are going to be doing this tabletop as well as non-gridded. So the typical projections for a tib fib or lower leg is AP and lateral, and we are going to be starting with the AP view. So I'm going to have Lexi come on over and lay on her back on my table here. I'll have you extend that left leg across our image receptor and go ahead and lift that pant leg up. And I'm going to palpate her condyles to ensure that there's no rotation in the lower leg. And I'm also going to ensure that this is done at a 40-inch SID. And then we are going to go ahead and we are going to center at the mid-lower leg region. While also ensuring that our collimation is open to include both the knee and the ankle joint. And then once your alignment and centering is all lined up, you're going to go ahead and put a left marker on the lateral aspect. And then lastly, before exposing, I'm going to go ahead and throw a shield over her gonad region just to ensure radiation protection. I'm going to lay this on you, okay? We also need to measure the part so we can set the appropriate exposure factors based on the width of her lower leg. So I'm going to go ahead and do that now. So it looks like she's right at 10 centimeters. So Lexi, I'm going to have you go ahead and hold still for me, okay? Okay, now that I'm behind this lead-lined wall here, I'm going to go ahead and set the exposure factors. Since this is a tabletop exam, we're not using AEC. We're going to look at our chart here for extremities, and she was 10 centimeters in thickness. So our KVP is going to be 70, our mass 3, and we are going to set a small focal spot because we are looking at bony detail. Now that I've set the appropriate exposure factors, I'm going to go ahead and expose. All right, Lexi, just lay still for me. Expose. So now we're going to do the lateral projection of the tib fib. So I went ahead and had my patient roll onto her affected side, which was the left side. And then I also had her put her unaffected leg back behind her to make sure there's no over rotation of that left leg. So we're going to go ahead and ensure that this is still at a 40-inch SID. To center at the mid-lower leg. And you also want to make sure that her left leg is in a true lateral, so the plane of the patella should be perpendicular to the IR. And you want to have collimation open again so that the knee and the ankle joint are included. And then you're going to put a left marker down. Make sure your shield is on the gonadal region for radiation protection again. And then I'm going to measure her part to get the correct thickness to set our exposure factors. Looks like she is at 10 centimeters for the lateral as well. Now that I'm behind the lead line wall again, I'm going to go ahead and set the exposure factors for the lateral projection. So we're going to look at this chart. She was 10 centimeters again, 70 kVp, 3 mass, and then a small focal spot again for this one because we are looking at bony detail. All right, Lexi, lay still for me. Expose. When performing a tib-fib x-ray, some other factors that may be helpful is possibly turning the image receptor diagonally to better fit both ankle and knee joint on the image. You could also slightly increase the SID up to 48-50 SID, but typically if you are imaging an achondroplasia patient, because their limbs are a lot shorter than the average, there should be no issue at all getting both joints in.